Hey everybody, this is Ben Bradley from AM Opportunities. If you've watched our Instagram lives, you may have seen me a couple times for Visa, Instagrams, and Mini CEX, and all of those great things. I'm joined today by our CEO, Kyle Swinsky, and first we just really want to thank you for being a part of this first inaugural World Medical Studies Conference. This conference embodies everything that AMO strives to work for and to do in this, and that really is, grow with and give everybody an opportunity to follow their reach that career that they want to have in physicianship or healthcare, wherever you want to work, United States, anywhere else. It's about equality of opportunity, and we're able to join. When Kyle and I started AMO, dorm room. We were at school, and Kyle was the AMSA chapter president for exchanges. And we heard from students directly that this was a broken system. There were a lot of students that wanted to train in the US, but there wasn't a good process to find these rotations. And, there were other organizations out there, but they weren't transparent. They were very much, you had to trust that organization. And we just saw that there was a different and better way to do this. So we built AMO, built around that transparency, that communication, and really equal treatment like all IMGs deserve. We know that IMGs need these experiences, these clinical experiences to get into the US medical system and to get into many other medical systems. We felt that by building our company into a platform where we could connect, doctors and students, but also US hospitals and international medical schools, we could create a new system to help further the dreams of you all, while also helping solve the healthcare labor shortage in the US. The US needs IMGs, and we know that, and this is about executing on that vision and mission and helping you really achieve that dream. So, just to recap, I really want to thank all of our speakers today. We got to hear a lot of really great topics. First, hearing directly from students and those who have made it on this journey, who have rotated with AMO, have gone on to residency, have gone on to match, just hearing their experience, hearing from them, and getting to ask them questions and just learning, you can do it too. I think that is really, really critical. Rod's presentation, Dr. Carrillo, Josue, Pedro, we just really want to thank you for your contributions and giving back to all these students. And we thank all of you students for joining and asking great questions and hopefully learning a lot. As we take the next step of the journey, we got to hear from many different great speakers on getting ready to enter into that residency match, test preparation, how to write your personal statement, how to prepare the best residency match application. So speakers like Judy Hook, Tamar Frolichstein-Apple, Dr. David Kuntz, and our very own Saidi Hood on how to, prepare for that interview, study for that test, write that personal statement. All of these things are really critical because there's a lot of information out there and things change very quickly. The change of step one from pass to fail, from graded to pass fail. It's important that you stay up to date on this information. You get to hear it directly from people who are involved in the process. And then finally, you got to hear about the next new frontier of medicine, right? In the United States in particular, this is a huge opening opportunity, and that is telehealth and virtual education. So from doctors like Dr. Lin, Dr. Kura, and our very own Dr. Palmer, you got to hear about the benefits of a virtual rotation and really how much effort and innovation and investment is being made into telehealth training, because the US medical system sees this is, the treatment of the future, especially in specialties like primary care, psychiatry, and we hope to grow this out and to include all specialties as we, progress and grow as a company over the coming years. Before I hand it to Kyle, I just want to say, I think you've probably taken this from the conference, taken this from our communication, from our own website, but as an IMG, you have to get more experiences than the average US MD student. And that means you need these clinical experiences. And the great thing about our platform is one of our founding missions, we want to have an experience that fits everyone's needs. Budget, virtual if you can't travel, hospital if you really need that inpatient hospital ACGME experience, research, virtual research. We're always adding new programs, but we want to be that key piece in helping you getting your residency match application over the line so you can match into that program of your dreams. So I'm going to go ahead now and pass it to Kyle. And again, thank you all for joining today.
Thank you, Ben. Can't thank everyone enough for joining this conference today. It's our first ever. And in reflection, it's all about you. It's about the students. It's about the speakers. It's about the AMO community. Becoming a doctor isn't an easy journey. It's a marathon that takes a lot of small decisions, big decisions. Don't know are big until they are, and that's what this is all about. When we started this conference, we were talking about how important the international medical graduate community is to the United States healthcare system, and that itself is also not going away after this pandemic. Before this pandemic, it's always been the case. And that's what we want to be here for as AMO, which we have been since day one, is really to make sure we give you the tools, the resources, everything you need to succeed, because we here really do believe in you. So on that, would love for anyone to take a peek at our social media accounts, take a peek at our website, make an account, and look at our clinical experiences. We have 2 upcoming webinars, one I believe on September 14th about the visas, how to get U.S. visas, and another one a month later on virtual rotations if you need more information after today's talks. Also, all of the conference sessions, resources will be available for 30 days after this conference. So feel free to log back in, download the sessions, continue to speak with the community. And I think it goes back to the fact that we made this free. Everything we do, again, is about helping you, because you're doing something so important right now with your career. Is you're making that decision, that step to say, look, I may be taking a jump into the unknown, but you're making the right choice. So on that, I want to make sure we first thank all of our speakers today. I know a lot of our speakers have gone through that journey, and they know what everyone's going through, and they know how busy their lives are as well. Just really thankful that they could take the time today. Also thought, it's very, very special that we had members of all across the AMO organization join moderating sessions from different departments, because everyone in an organization cares. A lot of people you may have seen that you may never have interacted with before. We're all here behind the scenes making sure that we can help. Also want to personally thank our marketing leadership, Donnie and Brittany, for deciding to host this conference. Really great idea. I think that this is our first. There's going to be more. We're really excited to take this to the next level with the next conference. Lastly, of course, I want to thank all of you that are attending today, because as I said, you're on a path that we're all thankful for. We're all here rooting for you, thankful that you're making this decision to become a physician and take care of lives. So with that being said, thanks so much for joining us for our first conference, and I look forward to seeing you sometime soon. Thank you.
Thank you all.